Hi. This topic we're gonna talk about how to answer the select or the apply questions, especially in relating to the time frame, the distance, the inches. So let's get into it. You can download the template under the descriptions. This presentation is for the purpose of private study and research. I have used Kaplan, UWorld, Registered Nurse RN, NCSBN, and a few other resources for these presentations. Okay, for time frames, I organize according to seconds, minutes, hours, weeks, months, years. So what that means is they will give you a certain conditions, and then for select order apply, they will either ask you to find the correct time frame or distance or inches. So it can be quite confusing to just remember so what I did is make a timetable for it. For example, 15 minutes, we do make round on patient with suicidal ideations. So the NCLEX RN question could say, patient has a suicidal ideations, with suicidal ideations, select order applied the management of care for this patient. So the one of question could say, do around 20 minutes checkup on patients. So that would be incorrect because the correct minutes should be 15 minutes. So that's why it's important to know the exact number. It's in order to eliminate the wrong answer, you need to know the exact answer. Again, here is the hours. For example, monitor IV site, we got 1 to 2 hours, and then we got 2 hours here for different conditions. And it's quite simple once you remember them in according. What I do is I go according from small to big again, and then just remember that it's quite easy. And then I got the days here. The days here. For example, months. We got 2 to 3 months. We do HbA1c for the diabetes test. To see how the management goes. So for NCLEX RN question, they could say patient diagnosed with diabetes and on the management. How often should they check their HbA1c? That's one question they could ask. Here is quite similar to the above slide, except it's for special situation because they got so many different hours or numbers. For example, for IV, you got 1 to 2 hours, 24 hours, 8 to 12 hours every 3 days. So rather than put them organized on the previous slides, it's gonna be quite confusing. I just put it in one table. That way it's easy to see. It's belong to the intravenous IV. So the NCLEX RN question could be asking, how often do we flush the IV cannula? It's between 8 to 12 hours. How long do we monitor the site? 1 to 2 hours, etc. Time frame again. This time is relating to the medications that we use because the NCLEX RN question like to ask, here are the 4 medications. Which one should you give first? And so let's say just 4 ordinary like blood pressure, diuretic medications, general pain medications, and then any of this one. Then my gut feeling usually is I'm going to go with this one because they got time frame related to the medications. So, and you can add more as you've seen this kind of question in the exam. You just add more medication to the list. For example, thrombolytics. Any of these three medication ends PLASE. The first thing we want to know is the time frame. How long has the patient had stroke? The question could ask, say, patients receiving any of these medications, and what's the first thing you need to find out? So we need to find out that the event has happened in less than 3 to 4.5 hours. Because once above that, then it's gonna be not effective. So yeah. This time, rather than time frame, I got a frequency, like once, twice, 3 times, regular, weekly, PRN. So, for example, PRN, breastfeeding, or access gag reflex. We don't like access gag reflex, like say every 2 hours. That's not a schedule thing. That's a PRN thing. PRN also, like PRN medications. At the chart at the back, there's PRN medications, which we don't give like every 2 hours, or like scheduled into every 2 hours. We give it to PRN and then time space out how many hours depend on the prescription. Okay, and then I just want to point out here about alcohol. Women usually women drink like 1 per night, or men drink no more than 2 drinks per day. The question with the NCLEX, sometimes they give you a conditions and then same patients taking alcohol. Not all situations are forbidden for drinking alcohol. For example, renal heart failure, we just limit the alcohol, but not as mean like no alcohol. Osteoporosis, taking aspirin, hypertension, 1 beer or 1 glass of wine per day. Then no alcohol definitely. Hepatitis, cirrhosis, and pregnancy. So during drinking alcohol, the time frame we have different effect to our body. 5 to 3.5 hours after last drink, we will see alcohol withdrawal. 48 hours afterwards, we will see a grand mal seizures. And then 72 to 96 hours, we will see a delirium tremors. Now, the reason for that is we need to know those 3. Is the question could give you, say, a patient had an alcohol drink, and then I made it to ED with the following situations. And then we want to find out when was their last drink. That way we can see where are they falling into, because each one, the treatment is going to be a bit different. Distance. For example, 4 to 5 inches, we apply tourniquet above the IV insertion site. This kind of question, they like it to put it into the select all the apply question. Length, 3 to 5 centimeter. Discard prior to obtain blood sample at peak line. So these are just the sample of the tables. You can adjust according to the notes that you got. Just analyze, just organize in one table, so it's clearly stand out for you, easy to remember. And that's all for this topic, and I'll see you for next one.